Today I've been dispatched to Amy here, who's had a syncopal event while she was in the shower this morning. Amy's mum heard a bang in the shower and rang the ambulance, so we've gathered a bit of history from her as we arrived on scene. Amy's mum ran straight into the bathroom and saw that Amy was lying unconscious on the floor. She was unconscious for about 10 seconds before she came around. Amy's got no obvious injuries following a secondary survey other than a bit of a lump on her forehead. So Amy, do you remember what's happened here today?
So I just remember standing in the shower and I felt really dizzy, and then I felt like I was going to spew, and then I just woke up on the ground.
Okay, and do you know what day it is today and what year we're in?
Monday, 2018.
Good, and do you know who I am?
The paramedics.
Yep, cool. Okay, so that's a great sign that you remember everything. You obviously haven't had a concussion, which is great. Is it alright if my offsider Chelsea here takes some vitals?
Yeah, sure.
Just while we have a wee chat. Has anything like this happened to you before?
Sometimes I feel a bit dizzy when I get out of bed in the morning, but not like this.
Okay, and how are you feeling now?
Yeah, I feel alright, just a little bit sore at the front here where I've hit my head.
Yeah. Can you poke your tongue out for me? Great. It doesn't look as though you've bitten it, which could indicate you may have had a seizure. Do you have any medical conditions or do you take any regular medications?
No, I don't have any medical conditions, but I take the contraceptive pill.
Okay, great. And have you had breakfast this morning? Have you been drinking plenty of fluids?
No, I just hopped out of the shower and then I only jumped out of bed and just hopped straight into the shower.
Okay, so it's likely you're pretty dehydrated after just waking up, which may have contributed to your syncope. And also taking the contraceptive pill can muck up your blood pressure as well sometimes. So Amy, do you have a headache at the moment?
No.
No? Great. Are you feeling dizzy or like the room's spinning?
No.
Cool. Any nausea?
No.
Any abdo pain?
No.
Any chest pain or palpitations?
No, it all feels good.
Yep, cool. And do you have any family history of cardiac problems or sudden death?
No, nothing like that.
Awesome. So it's quite likely that you haven't had any cardiac problem that's caused you to have a syncope today, but we will get Chelsea here to do a 12-lead ECG.
Yeah.
Just a few stickies on your chest just to make sure.
That's all good.
Great, I'm just going to do a fast test now to rule out a stroke.
Yeah.
So can you squeeze my hands for me? Awesome. And do you have any weakness anywhere on your body?
No.
I'll get you to smile at me with your teeth. Awesome, so you got no facial drooping. Can you put your arms out in front of you and turn them over and close your eyes? So there's no drift either, which is great. And I'll just get you to uncross your legs and can you push on your feet with me? Cool. That is awesome. So no obvious signs of a stroke either, which is great. Can you name the subject for me?
Drink bottle?
Yep, cool. And is it alright if I have a quick wee look in your pupils?
Sure.
Great. So just get you to look straight at me. Perfect. They are great. So Amy's got nice reactive pupils and they're both the same size. And do you remember feeling short of breath before or after your syncope?
No, just dizzy.
Awesome. I'll just grab my vitals from Chelsea there if you've got them.
Blood pressure 125 on 85, heart rate 80, strong and regular, rest rate 16, temp 37.6, blood glucose 4.2, cap refill 2 seconds, and 12 lead with sinus rhythm.
Awesome. So all of your vitals are looking perfectly normal, which is
cool.
Great. I just have to do a blood pressure while you're standing, just to compare with the blood pressure we've got from Chelsea while you're sitting. So I'm just going to pop this on your arm. Yeah, if you don't mind. So it's just going to get a wee bit tight on your arm. And we're going to do it as soon as you stand up, alright?
Yep.
Great, so Amy's blood pressure remained at 125 on 85, so there's no signs of postural hypertension. So I'm just going to get you to, while we're standing, go for a wee walk to the kitchen for me. Perfectly normal gait, and it doesn't look as though you've got any problems with your balance either, which is good signs. So have you had any coughs, colds or flus recently?
No, I've been all well.
Cool, so you're nice and fit and healthy and you haven't had any extra stresses in your life at the moment?
No, I'm on my uni break at the moment, so life's pretty sweet.
Cool, and are you on your period at the moment?
No.
No, and is there any chance you could be pregnant?
No.
So Amy, my provisional diagnosis is that you've had a vasovagal syncope, just as a result of being supine overnight while you were sleeping and then jumping in a hot shower.
Yeah.
So it's completely normal, nothing to worry about. So Amy's had some prodromal symptoms of nausea prior to her syncope, as well as postdromal symptoms of fatigue, which support the likelihood of a vasovagal syncope. Amy's also a teenager and takes the contraceptive pill, which can cause an imbalance of hormones and trigger a syncope. Through my questioning and obtaining Amy's vitals, there doesn't seem to be any red flags associated with Amy's syncope, but I will double check in my guidelines to make sure that I haven't missed anything. So Amy's vital signs are all within the normal ranges. She was returned to her normal self. She's feeling fine and she doesn't look to be particularly pale. Amy's got no cardiac history and no family history of sudden death, so I think it's unlikely there's been a cardiac cause for her syncope. She's also got a nice sinus rhythm on her 12-lead ECG. There's no new or unexplained shortness of breath before or after the syncope, and Amy hasn't been significantly injured. She's just got a little bit of swelling on her forehead. The syncope didn't occur during exertion. She's not pregnant, and she didn't have a headache before or after the syncope. And Amy's got no known valvular or congenital disease. There also doesn't appear to be any neurological deficits or cardiac causes of her syncope, and Amy has been otherwise fit and healthy with minimal stress. The event doesn't meet any of the orange flag criteria either, which includes age under 16, postural hypertension, family history of sudden death, and a history of heart failure. Because of this, I believe it's safe to leave Amy at home. So Amy, it'd be a good idea to take it easy this morning, have a nice big breakfast and drink plenty of fluids. In the future, it might be a good idea to eat breakfast and have a big glass of water when you wake up before you have a shower, and just try and limit your exposure to the hot environment. It also might be worthwhile to mention this to your doctor the next time you're visiting, and just to see if there's any effect from your contraceptive pill. Cool. Are you happy with all that?
Yeah, that sounds really good.
Have you got any questions?
No.
Great. Before we leave you at home, I'll just check my non-transport checklist.
Today we've been called to a 35-year-old female complaining of back pain that she's been experiencing for the last year. However, she woke up this morning and it's much worse than usual. She had a blood pressure of 110 or 90, a heart rate of 68, a temperature of 37, a BGL of 5.3, and a respiratory rate of 16. I gathered a quick patient history using the sample acronym. From this, I found that she has 6 out of 10 pain compared to her usual 3 out of 10 pain. She states that this pain is still achy, as it usually is. She takes no medications, has no allergies, and has no past medical history. She has been eating and drinking well. Previous to this injury, she was lifting heavy boxes yesterday as she was moving house. Now I'm going to do a full physical examination of Chelsea's back to try and work out what's going on today. Now Chelsea, I'm just going to get you to roll onto your side, if that's not too sore for you.
No, that's all right.
And I'm just going to look at your back, okay?
Okay.
Looking at her back, I'm just checking for any bruising, swelling, or rashes. That all looks clear. So now, Chelsea, I'm just going to palpate down the centre of your spine. You just need to tell me if you're feeling any pain. Okay. Is that all okay?
Yep.
Okay, now I'm going to feel either side, and you just need to tell me if you feel any pain again.
Oh, yeah, a little bit there.
Right here, down
Yep.
the lower back, on both sides?
Yep.
Okay. You can roll back over now. Does that pain radiate you at all?
No, just kind of across my back.
So it's just across your back. And if you were to rate this pain, before you said it was 6 out of 10, but when I palpate it, what would you say the pain is?
A 7-ish.
7-ish. Okay, so it is quite sore.
Mm-hmm.
Do you have any chest pain with that?
No.
No? And do you have a sore abdomen at all?
Nope.
Feel nauseous or like vomiting?
No.
Okay, so I'm just going to do a quick feel of your abdomen.
Okay.
You just need to let me know if you feel any pain anywhere.
Okay.
Does that all feel okay?
Mhm.
Okay. And have you been able to go to the toilet as per usual?
Yep.
Haven't lost bladder control or bowel control at all? Okay.
Normal.
And do you have any numbing sensation in the saddle area at all?
No.
Which is around the groin and crotch?
No, don't.
No pins and needles?
No.
And does this pain, you said it didn't radiate before, but just to clarify, it doesn't radiate down your legs?
No.
And do you have any altered sensation in your legs?
No.
Nothing?
Pretty normal. No.
Okay, and don't feel like you've lost strength
No.
at all? Okay, so it's just this lower back pain?
Yeah.
7 out of 10?
Yeah.
And it's to either side, not central?
Yeah.
Okay. Is your pain made any worse or better when you're lying down flat?
No.
No. And does coughing elevate the pain at all?
No.
Okay, cool. Now I'm just going to do a neurological assessment. I know that you said the pain is just in the back, but I just want to check that there's no altered sensation and that you've got the equal strength on both sides.
Okay.
So first of all, I'm just going to check your pedal pulse. I can feel that on both sides, which is a good sign. And if I feel the ends of your feet, Does it feel the same?
Yeah.
No different?
No.
No burning down your legs at all?
No.
Okay, so if I put my hands here and you pull your feet back towards you, does that feel okay?
Yeah.
And pushing it back down, all right?
Yeah.
Cool, and I can feel it's equal on both sides. So now I'm just going to get you to do is just bend your knees for me. Any pain when doing that?
No.
And if you straighten them back out, and then just lift one leg at a time. Any pain?
No.
And the other side?
No.
It all feels good.
Yeah.
Cool. That's all really good signs. So today, have you tried to walk at all?
A little bit, yeah.
A little bit, but it's quite painful.
Yeah.
Have you taken any pain relief for this?
No.
No. Okay. So have you taken Panadol before?
Yeah.
Ibuprofen?
Yeah.
Tramadol?
Yeah.
So no allergies to those?
No.
And there's no chance that you're pregnant?
No.
Okay. So I'm happy to give this to you today. Alright, so before I give you these 3 medications, I'm just going to drug check it with my crew partner.
Yeah.
Cool, so they're all November 2018.
Yep, November 2018.
Alright, so I'm going to give you 1 gram of paracetamol, 400 milligrams of ibuprofen, and 50 milligrams of tramadol.
Okay.
Because you weighed under 80 kgs.
Yep.
Cool, so just put those in your hand. And have a glass of water.
Thank you.
Right, sit up. Alright, so I'm just going to try and get you to sit up for me today. And try and get you to mobilise around your house. I just want to see you walk.
Okay.
Do you think you're okay to do that?
Yep, I'll give it a go.
So I'll ask you to slowly swing these legs around. Alright, and I'll just get you to walk to the couch over there. Walk back. Alright, so how does that feel, Chelsea?
It's a little bit sore, but it's
A
right.
little bit sore. What would you say the pain is if you were out of 10 again when you're walking?
About a 6.
About a 6. Okay, so the Panadol, ibuprofen, and tramadol that I've given you will take about 20 minutes to start working. So hopefully once it starts working, that pain will drop.
Okay.
If I just got you to sit back where you are. Actually, no, I'll sit you here.
Okay.
Are you able to reach forward and touch your toes?
Yeah.
Is that okay?
Yeah, it's right.
A little bit painful still.
Yeah, that's
Okay. Have you had any unexplained weight loss recently?
No.
And do you have a history of drug use?
No.
Okay. So based on my assessment, there's no neurological changes, but you do have obviously that muscular pain at the lower back. My diagnosis is that it's a musculoskeletal injury.
Okay.
Because you're lifting heavy boxes yesterday. So I'm happy to leave you at home today.
Okay.
Are you okay with that?
Mhm.
So what I suggest is, do you have Panadol or ibuprofen at home?
Yep.
So per the packet instructions, you can take that. Make sure you're taking it every 4 hourly to help with the pain.
Yep.
If the pain does get significantly worse, feel free to call us back.
Okay.
If the pain doesn't resolve at all, see your GP. And I suggest that you try to keep moving as much as possible, because the longer you stay still, those muscles are going to tense up and it's going to make it quite a lot worse.
Okay.
And maybe once the pain has resolved, you could go to like a back rehab program to try to help you with this, because obviously it's not very comfortable having this for the last year.
Yeah.
Does that all sound okay with you?
Mhm.
So before I do leave you, I'm just going to go through some red flags in my book,
Okay.
just to make sure that everything's fine, and then we'll head on our way.
Okay.
So checking off my red flags, just making sure it's okay to leave Chelsea at home. The first one is loss of bladder control or bowel control. So Chelsea did not have that today, and if she did, that would be indicative of a compression of the spinal cord between S2 to S4. She didn't have a temperature greater than 38 degrees, it was 37. She didn't have rigors. All her vital signs were within normal limits. There was no pain in the thoracic spine or chest. There was no abdominal pain or tenderness. She had no altered sensation in the saddle area. This would be indicative of a compression of the nerves underneath the spine, at the bottom of the spine. She had no altered sensation or power on both legs, which could show a prolapsed disc or spinal cord compression again. She was able to walk, as we saw. She had no signs or symptoms of generalised illness, and she did not have pain radiating down both legs, which could show involvement of the sciatic nerve. Going through the orange flags, she had no past medical history, so didn't have cancer or osteoporosis. She's not immunocompromised, as she wasn't taking any medications such as steroids. The Pain wasn't worse when lying down or at night. She had no recent unplanned weight loss, and there was no IV drug use evident. So just going through my non-transport checklist with you. We've done a full set of vitals on you today, and everything is normal. You don't have any serious illness or injury today. There are no red flags present for back pain. The patients that you've been seen to mobilise today as you walk to the couch and back to me. So I've given you information on when to seek help, and I'll put out an EPRF for paperwork for you, so you'll be able to look at that yourself.
Okay, cool.
Are you all happy with that today?
Yeah, very happy, thank you.
Cool.
Okay, so I've been dispatched to a 30-year-old woman complaining of a headache. So while I ask her some questions, I'm just going to get my officer to do some vital signs. All right, so Kate, when did your headache start?
About 2 hours ago.
Okay, and did it come on suddenly or gradually?
Quite gradual.
Can you describe the pain for me?
It's kind of like a dull ache in my forehead here.
Okay, so can you point to where it is also?
Just around here.
And so it doesn't feel sharp or throbbing?
No.
No? And does anything make the pain better or worse?
No, not really.
How about if you look into a light, does that change it?
I prefer a dark room, but it's not that bad.
Okay, so what were you doing when it came on?
Nothing really. It's just at work.
Okay, was it stressful at work today?
Yeah, it has been a bit stressful lately.
Okay, so has it progressively got worse throughout the day, or has it stayed relatively the same?
Pretty much the same.
Okay, and if 0 is no pain at all and 10 is the worst pain you could imagine, what would you rate your headache currently?
About a 4.
Okay, and does this pain go anywhere else, like your neck or your jaw or your ears?
No.
No?
Just in my forehead.
Okay, so are you on any regular medications?
No.
No, and have you recently been prescribed any new medicines such as antibiotics for an infection or something like that?
No.
No, okay. And have you taken any medicine for your headache today? Any pain relief?
Yeah, I had some paracetamol and ibuprofen.
Okay, and how long ago did you take those?
45 minutes ago.
Okay. So have you also been drinking and eating as you usually would?
Mhm.
Yeah, and you've been going to the toilet normal and everything?
Yeah.
Okay, and do you suffer from any medical history or problems such as diabetes or asthma?
No, I've got migraines. I've had migraines before.
Okay. And have you got a history of any brain bleeds or strokes in your family or personal history?
No.
No. And does this feel like your normal migraine to you?
It's a bit worse than normal.
Yeah. Did you have do you get an aura with your usual ones?
Yeah.
Yeah. And did you get that today as well?
Yeah, I did. Yeah.
Okay. Have you had a migraine that's been this painful before?
Yeah, I had one about a year ago. This bad.
Okay. You haven't had any recent knocks to the head or trauma at all?
No.
Haven't had a fall or anything like that?
No.
No. Okay, cool. Okay, Kate, so what I want to do now is test some of your cranial nerves, which will involve me touching your face. Is that okay?
Yeah.
Cool. So before I do that, I just want to know whether you've had any changes to your senses, so your hearing, your vision, your taste, or your smell?
No, it's all good.
Cool. So I want you to tell me whether your ears hear the sound the same or different.
The same.
Okay, cool. So now I'm just going to touch your face, and you tell me whether it feels different or the same.
The same.
Yep. Okay, cool. So now I'm just going to feel your sinuses as well, and they're not swollen, which is good, and you've got no pain in here?
No.
No? Okay, cool. Alright, so now I just want to check for temporal arteritis as well. So I'm just going to place my fingers in a temporal here, and I'm just going to check for a bounding pulse on either side, which there isn't, so that's good. Okay, so that's all good. Now also what I want you to do is to follow my finger. So we're going to take it all the way out to her peripheral, hold it there. So I'm noticing that her eyes are moving together, and also that there's no nystagmus. Come back over this side. Cool, so that's all good as well. Push against my hand. Yeah, pull up. Sweet, so she's got a negative fast test, which is good. Also, have you had any lightheadedness or dizziness or vomiting?
No.
Any of those three things?
No, none of them.
Okay, sweet. So that's all looking good, Kate. So good. Amy, what are my vitals?
So the blood pressure is 125 on 85, a heart rate of 80, a respiratory rate of 16, a temperature of 37.6, a VGL of 4.2, capillary refill time of 2 seconds, and the 12 litres sinus rhythm.
Okay, awesome. So all your vital signs are looking good, your heart rate and your blood pressure and everything like that is checking out good. So I don't think there's anything sinister going on with you right now. I just think you're maybe experiencing a migraine with different symptoms than usual. As you've said, that it's more painful. So I don't think the emergency department is where you need to go today. So what I recommend is that either we take you up to see your GP, or a family member, if someone's home, can take you there. Have you got anyone home at the moment?
Yeah, my husband's in the office. He can take me.
Okay, cool. So that would need to be done in the next 12 hours. So if possible, we could leave you and then he can take you straight there.
Yep.
Also, what I recommend is that you take your own some pain relief every 4 hours. So you said that you've had paracetamol and ibuprofen, so I can assume you're not allergic to that. But do you have any allergies to any other medications?
No.
No, cool. So if you just continue taking that every 4 hours, do you have your own paracetamol and ibuprofen? Okay, sweet. So before we leave you, Kate, I just need to run through some red flags and just make sure that I haven't missed anything. So you don't have a headache or neck pain following neck manipulation. You don't have neck pain or neck stiffness. There wasn't a sudden onset of a severe headache. Your temperature wasn't greater than 37.5 degrees. You haven't been vomiting. There's no focal neurological signs. There's no altered level of consciousness. Kate has been GCS 15 throughout. There's no worsening of the headache following a recent trauma to the head. She hasn't taken any anticoagulants or has a known bleeding disorder. There's no signs of temporal arteritis. There's no hypertension during pregnancy. There's no previous history of intracranial bleeding, and there's no family history of cerebral vascular abnormalities, and it did not occur during sexual activity. So lastly, I just need to run through my non-transport checklist. So the patient's been fully assessed, including a set of vital signs, and appropriate investigations have been done. None of her vital signs are significantly abnormal. She does not have a serious illness or injury. There's no red flags that are present, and the patient needs to be seen to mobilise before I can leave, and I need to just note her gait. And the patient has been given explanation of when to seek further help, and an EPR will be completed and a copy will be left behind with some instructions and advice, which has been said to Kate that she needs to see her GP within the next 12 hours, as a migraine with different symptoms than usual is an orange flag. So Kate, what I need to do before I'm able to leave you is I just need to see you stand up and go for a little walk. If you could just walk out to your kitchen and back for me. Cool, so as she's walking, I'm noticing that her balance is normal and her gait is normal as well. Cool. Awesome. So are you happy with that plan?
Yep.